Session 2, Family Planning, Conception and Pregnancy. Conception is the encounter of a male sperm and a female egg that produces a fertilized egg. Pregnancy takes place when a fertilized egg after conception gets out of the fallopian tube and enters into the uterine cavity, where it will be developed and called a baby 9 months before birth. Primary signs of conception are lack of menstruation, breasts swell and having nausea, lack of appetite and change of feeling. Some of the consequences of conceiving and being pregnant without being prepared are putting your life in danger as it can result in death, being isolated and stigmatized. It can cause you mental depression. It can cause you getting earlier marriage or before you need it, and stopping studies, among others. Ways of avoiding conception for teenagers are abstinence, avoiding sugar daddies, avoiding drug use, avoiding gifts from people of opposite sex, avoiding bad groups, using condoms if you cannot abstain, using other methods of family planning, giving information in due time about a person who wants to trick you, avoiding being alone with a person of an opposite sex, searching for genuine information about sexual health reproduction. Modern family planning methods include condoms, pills, injectables, implants, intrauterine devices, permanent methods, or sterilization. Availability of contraceptives. Contraceptives and other family planning methods are available in the following institutions: in health centers and all public hospitals or sponsored by the government, in private clinics and pharmacies, in centers providing reproductive health services to the youth. Some of this medicine is already being given by community health workers in villages. Adolescent health. Puberty and adolescence. At adolescence, children start growing very quickly. They become big and tall. Their sexes become larger and they start having signs that differentiate a boy and a girl, a man and a woman. Adolescent girls and boys between the age of 10 to 19 have the right to information about reproductive health, but they have to be reminded that having rights about reproductive health does not mean to engage themselves in sexual relations. It is true that reproductive health is rights and no one is allowed to deprive someone of it. Body changes in adolescence include growth of pubic hair in both girls and boys, development and enlargement of breasts in girls. Voices become deeper, wet dreams in boys, menstrual cycle in girls. Adolescents, both boys and girls, show some changes in emotions and the relations among themselves, between them and their parents, the family, and the society in general. Those changes depend on the production of the hormones and how the society views them. Those hormonal changes go hand in hand with particular problems. Thus, there's a need to talk to the adolescents to explain to them what is happening to them and, if necessary, to provide them with some advice, including counseling. Gender-based violence, gender equality, and gender complementarity. Equality is a fair treatment of a boy, a girl, a man, or a woman, basing on laws and regulations and having the same opportunities and services that they are given in families, in their home places, and in the countries of residence. Complementarity is a situation in which a boy or a girl, a man or woman are involved in activities without any inequality. There are several things showing the sexual identity in general, including sex, gender. Gender is established by a given society or culture and it can change with time. Gender refers to difference between men and women created by society on the basis of sex. Gender includes an equal treatment and equal power between men and women, gender roles taught to boys and girls, and our idea of what is male or female and roles ascribed to them. Violence is an unpleasant action done to a person being on the body in reasoning on sex, property, depending on female or male. That action prevents a person's freedom and has some negative consequences on him or her. Violence can be done at home or elsewhere. Gender-based violence is an action done on a person, be it on the body, sexual organs, or to deprive him or her rights on property, other things, because he or she is male or female. Types of gender-based violence and how they are identified: physical violence, sexual violence, emotional or psychological violence, economic violence. Strategies to implement: 1. Expand the SBVGs services at health center level, increase the laboratory capacities for testing, establish an effective monitoring mechanism for the follow-up of SGBV.